everyone, I'm Dr. Gan Lee Ping from Radium Medical Aesthetics. Today I'll be speaking on the topic of melasma. Melasma is a common chronic pigmentary skin condition involving a symmetrical distribution of patchy brownish pigmentation all over the face. It can also affect the person's arms and back, thus leading to considerable distress and embarrassment for the affected individual. The exact cause of melasma is extremely complex. So one postulation is that the pigmentation is caused by overactive melanocytes or the color-producing cells in the body. We believe that the excessive stimulation of these melanocytes actually results in increased deposition of pigmentation in the skin. Some of the known risk factors for melasma would include genetic predisposition, chronic sun exposure, pregnancy, hormonal changes, as well as certain types of medications. Yes, there are three different types, namely epidermal, dermal, as well as the mixed type of melasma. They are differentiated based on their appearance under Wood's lab examination. The first type of melasma would be epidermal type of melasma, and typically this involves dark brown patches on the skin with a well-defined border. The second type of melasma, which is the dermal type, would involve grayish-blue patches on the skin with a less well-defined border, and this type of melasma typically affects the deeper dermal layers. The third type of melasma, which is the mixed type of melasma, would involve a combination of both epidermal as well as the dermal types. And typically what we see is a mixture of both brown and greyish patches on the skin. Melasma can affect practically anyone, women more so than men, especially women who are pregnant or undertaking hormonal medications. For that reason, melasma is also known as the mask of pregnancy or cholasma. Over here at Radium, we have a combination of treatments, namely oral, topical, as well as procedural. The procedural type of treatments would involve chemical peels as well as lasers. Lasers being the Q-switch laser, PicoShield laser. It is very challenging to treat melasma. Depending on the type of melasma you have, some types are easier to lighten than others. However, it's important to note that melasma is a chronic, recurring lifetime condition and may eventually surface again at one point or another. While there are treatments available to manage melasma, it's important to stick to the skincare routine that your doctor has in place for you, making sure to keep sun exposure to a minimum, as well as ensuring regular application of a broad spectrum sunscreen of at least SPF 50 daily.